Here's the co-anchor of ABC's 2020, John Stossel. He has an upcoming segment on Canada and the British healthcare system that will air tomorrow night in 2020. We don't even know who's writing all of this stuff. We don't know what's in it. They made a compromise with the Blue Dog Democrats. There's no paperwork on it. We don't even know what the compromise was.
I don't know. I assume we'll know before they pass it.
Really? What gives you that?
We saw some congressmen saying, look, I'm reading it right now. See, you can't say I didn't read it. Like, look, Mommy, I read the bill.
Very good. Okay. So when I say don't let this thing pass in any form, I'm concerned that there is just they're changing the structure of our country piece by piece, you know. There's no good government
I don't think there's much good government. I think government is a necessary evil. That's why the founders were brilliant about talking about limited government.
Oh, please. Necessary evil. Now, go ahead and quote George Washington some more. Okay. The system that I have seen around the world that everybody else just loves. You have a piece in the segment tomorrow night. From, is it Canada or where?
We have some from England, some from Canada. It's portrayed as paradise. They live longer, they spend less, it's great, they like their systems. But when government takes charge, there are unintended consequences.
Okay, let's see this clip, please.
1.7 million Canadians say they can't get a family doctor. Some towns, like this one outside Toronto, hold a lottery. Once a month, the town clerk gets this box out of the closet. Inside are names of everyone who wants a family doctor. She pulls out 4 slips and then calls the lucky winners.
I just want to let you know that your name has been drawn for Dr. Keel's patient list. Oh, you're quite welcome.
Others in town must wait.
And that's just one example, both in Canada and England. If you're going to give people free stuff, everybody wants it. Some people can't get it. But of course, the politically connected, they get treated very quickly.
John, did you find any evidence of real rationing because I've heard this several times that in England, if you're over a certain age, you're not going to get stuff. You're not going to get, kidney dialysis if you're, 65 or something like that. Is any of that stuff true?
Sure, and many of the drugs that are approved for patients in this country, the National Health Service won't pay for. With or without Obamacare, we're going to have rationing in America. Medicare is $30 trillion in the hole. It's a Ponzi scheme.
here in New York City, the number of people on Medicare, I think, has doubled, hasn't it, in the last 10 years?
Politicians keep saying more people should be eligible. Let's make the Ponzi scheme bigger.
So are they just that stupid, John? Or they...
Maybe they just don't want to think about it when it comes to unfunded liabilities, economics, the future. It's too complicated.